In this video, we are sharing an overview of the National Online Information Product Audit, initiated by the 7 regional Genomic Medicine Service Alliances across England and undertaken by Gene People. We will be talking through the background, why this work was needed, the process of selecting a partner organisation, and the results of the audit. My name is Barbara Coleman, and I'm the Communications and PPIE Lead for the North West GMSA, and I'm joined by Dave McCormick, our PPVP Chair, Anthony Sutcliffe, the Project Lead, and Samantha and Emily from Gene People. So let's begin. Dave, can you provide a rationale for the project, please?
Thank you, Barbara. Yes, indeed. So following a review of a sample of Northwest Genomics Medicine Service Alliance online patient information leaflets by the PPV panel colleagues, as led by me, some trends were identified regarding good practice and areas for improvement. I extended this sample review to 2 other GMSA websites, and as I suspected, discovered similar trends. From this, an initial project proposal was developed. The Online Information Product Audit, or OIPA project, aligns with the wider mission and goals of the National Genomics Medicine Service by ensuring that patients can find accessible, readable, and clear online information about various precision testing projects and initiatives which are taking place in their region. By improving existing and new online patient information products in this way, this project aims to help embed the power of genomic science into routine healthcare to improve patient outcomes in an equitable and inclusive fashion. So the project focused on stakeholder engagement and patient value as being key. Not only have we worked to ensure collaboration with and buy-in from all 7 GMSA regional partnership boards and communication leads, but we were determined to commission in a suitably experienced independent third sector organisation who could give us impartial and informed feedback in terms of what's working well with the range of online information products for patients reviewed, but also what needs to be improved and how, with a focus on accessibility, readability and scope. Ultimately, we would like to see these good practice guidelines leading to a balanced approach by promoting regional creativity for all online patient leaflets regarding genomic science initiatives, which are available whilst ensuring that all product authors are able to understand and agree to follow these good practice guidelines to ensure that these products are accessible, readable, and more importantly, to stick to the topic that they were designed for.
Thank you, Dave. That's fantastic. Anthony, if I could come to you now. Please share the process involved in identifying a partner organisation and the key planning and project milestones.
Great, thanks, Barbara. So when we began this work, our initial scoping made clear that there was a real variation nationally in how online patient information was being presented, both in terms of accessibility and readability. We wanted to take an evidence-based approach to understand what's currently working well, where the gaps are, and how we could develop a consistent standard across regions. So the objectives were threefold, as Dave mentioned. Assess the accessibility, scope, and use of plain English in existing genomic patient materials. Identify best practice in areas for improvement. Produce a set of national recommendations to guide how online information products are designed in the future. To deliver this independently and objectively, what we needed was a partner with specialist expertise, not only in genomics, but also in health communication, accessibility, and patient engagement. Gene People stood out to us immediately. Their organisation works directly with people affected by genetic conditions, and the values of inclusivity, collaboration, and trust are completely aligned with the aims of the project. We wanted a partner who could offer that blend of lived experience, technical knowledge, and a track record of communicating complex information in ways that people can genuinely understand. From the outset, this was a co-productive partnership. Gene People worked really closely with us and the group throughout, sharing drafts, discussing the checklist tool, and aligning on best practice. Our expectation wasn't just that they'd do the audit and hand back a report, but that we'd work with all stakeholders to build capability across regions. That's why we emphasise transparency, shared learning and consistency, so that every GMSA could take something actionable away from the process. The project was structured around key milestones. Gene people worked with us to refine the scope and agree deliverables before completing a literature review of national and international guidance. We then focus on gathering sample materials from each of the GMSAs and developing bespoke audit checklists, which became the foundation of the review. The audit itself was then carried out, reviewing the written materials across topics in whole genome sequencing, genomics in cardiology, and genomics in lung cancer. Finally, Gene people synthesised the findings, identifying strengths, gaps, and opportunities for improvement, and the project concluded with a comprehensive final report and a set of recommendations. Thanks, Barbara.
That's great. Thanks, Anthony. And if we can invite Samantha and Emily from Gene People to share their feedback on the project, the audit process, and most importantly, the findings and recommendations.
Thank you, Barbara. I'll take that first. Just to explain that at Gene People, we conducted the audit as Anthony has outlined, and we did that by firstly carrying out a review of what existing tools and guidance there was already existing that were relevant to evaluating written online patient information. Videos and audio were not included in this audit. We did not find an existing tool that covered all that we felt was required for this audit. Notably, guidance for developing genomic patient information specifically is limited, but there have been some publications in recent years that have been extremely helpful. Some of those main guides and checklists that we drew upon included the NHS Digital Service Manual, which is a core set of guidelines and standards for anyone creating online content, resources for the NHS, the how-to toolkit for creating accessible patient information that was produced by Genetic Alliance UK and Genomics England. Another useful resource was a paper about co-design of patient information leaflets for germline predisposition to cancer, which was by Cohart and colleagues. Another item was the expanded ensuring quality information for patients scale, which was a scale that we could have potentially used, but we felt that it missed some key elements that were specific to genomics and accessibility. And also to mention, the final key guidance, of course, was the Web Content Accessibility Guidelines, or WCAG 2.2. There were other guidance as well, but drawing on all of these, we created a bespoke 52-item checklist and was in 4 sections. The format, so the 4 sections included format the material was in, how the material was produced, such as were patients involved in the production of the material, the content and the design, and accessibility, including an assessment of the reading age of the content and things like the availability of alternative formats, as well as much more. So this audit checklist we then applied to the materials that were sent to us from the GMSAs. So each of the 7 GMSAs, as Anthony has said, were approached to send us examples of online written patient information covering those 3 exemplar clinical areas of whole genome sequencing, genomics in cardiology, and genomics in lung cancer. And we ended up with a total of 18 materials being submitted, as it happened that some GMSAs sent us the same materials. So we had 18 different materials to audit, and these consisted of 10 PDFs, 6 web pages, and 2 Word documents. So those were the materials that we audited, and I will now pass over to Sam to tell you more about what we found.
Great, thanks, Emily. Well, as you can imagine, the audit found that while there was examples of good practice and some strong foundations across the regions, there was significant variation in both quality, accessibility and readability of the patient-facing genomic information. However, there were notable strengths. The content was generally clear and well structured and written in an inclusive and supportive tone. The medical and specialist terminology was typically well explained. The intended audience and the context of use were often made clear. As well as you can expect those strengths, there were areas for improvement. So most materials did not meet the recommended UK average reading age of 9 to 11 years. Few materials included patient testing, evaluation, or co-design. Accessibility gaps were widespread, particularly around the compliance with the Web Content Accessibility Guidelines, inclusion of alt text for images, and provision of alternative formats or languages. The emotional and psychosocial considerations were rarely addressed in the materials, and post-clinic support needs were often missing. The publication and review dates, signposting to support organisations, and local contact details were inconsistently included. So having pulled together that audit and reviewed all of the materials, as Anthony said, we put together some recommendations for a set of nationally applicable recommendations to support the development and maintenance of high quality genomic patient information. These include writing for a reading age of between 9 and 11 years. That we feel is a really key recommendation. Using images to enhance, not replace text with appropriate alt text for accessibility. Ensuring that the WCAG 2.2 compliance and clear routes to access alternative formats and translation, incorporating patient and public review into content development, including local service contacts within nationally produced materials, displaying the publication and review dates clearly, acknowledging the emotional impact and describing what happens after clinical contact, and embedding staff training and applying best practice guidance consistently across organisations. And in terms of the next steps, this webinar is actually one of the next steps. We want to really make sure that as many people as need to see the recommendations and report can do. So there will be a national executive summary and infographic, this webinar and an associated podcast to support awareness and implementation, coordination through the GMSA regional networks and third sector partners to ensure the national reach and local relevance. And future work will focus on supporting the GMSAs and national partners to apply the recommendations, address the accessibility gaps, and progress towards a coordinated, centralised approach for producing and maintaining genomic patient information in England. Thank you very much, Barbara.
That's great. Thank you both. Thank you everybody for that. Thank you to all our contributors, and we hope that this recorded discussion supports that wider understanding and action towards improving online information within genomic and genetic services. For more information or to get involved, please contact us via our website.